Oh, oh my goodness. Wow. Like instant, just pressure, like pressure's gone. Wow.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, as going over the paperwork and then we're talking with you, so you have been experiencing migraines. Now, currently you don't have one, which is a good thing, but when you have a migraine, it's almost debilitating. You gotta be locked in a dark room, no lights, no anything. No,
Right.
As you're just saying, smells would, like the scent would set it off or make it worse. Lights make it worse. I'm guessing sounds as well?
Mm-hmm.
Okay, sounds also make it worse. And then when you have that, how long does that migraine typically last?
2 to 4 days.
2 to 4 days, okay,
Mm-hmm.
so, okay. Does that ever affect any, like, jobs?
Oh, absolutely.
Absolutely, okay.
Everything.
Everything, so social life, everything.
Work.
So, definitely not a good thing to have. So, I mean, you're having them about 3 to 4 a month. Okay, that's, yeah, definitely not something you should be living with. Now, you've gone to, because you've tried other avenues to get rid of your migraines. I know you said you've been to other chiropractors. You haven't had any relief with that. You've been to massage therapist. Somewhat helps, somewhat doesn't, as you're kind of saying. Any medications, anything like that, or?
Excedrin,
Okay.
ibuprofen.
Okay. And then, does that help a little bit? No. Okay, so that over-the-counter medication is not helping at all. And so, let's go through. So today, what I want to start off with first, I want to get just kind of a baseline of where you're at. So I am actually going to have you sit up for me. And I just want to run through some ranges of motion. I want you to look all the way up at the ceiling for me. Any pain, tenderness, tightness with that? Good. Look all the way down to the floor for me. Any issues with that?
No.
Good. I'm going to have you bring one ear to one shoulder. Any issues with that? And then to the other side. Any issues there? Good. And then if you were to rotate your head over either side, any pain, tenderness, tightness with any of that?
No.
Do you feel any loss of like range of motion?
No.
Okay, good. Okay. So what I'm going to have you do, I'm going to do a couple orthopedic tests. Sit up nice and straight for me. Good. I'm going to push down on the top of your head.
Okay.
Any pain with that?
Mm-mm.
Good. We're going to turn your head to the side. Any pain with that? Good. And to the other side. Any pain with that?
It feels good.
Feels good, actually. Okay. So, good thing, no positives with any of that. But granted, it's not like you're experiencing migraine right now. Now, you were saying when you did have them, you felt it in the neck,
Yeah.
and then you were even feeling, what was it, like you
The balls of my head,
okay.
all the way around to my cheekbones, down
Okay.
my neck.
And then, so when you have, yeah. So all of that is just what,
Yeah.
like, tight.
Hurts so bad.
Okay. Okay, so all of that, and that's all right in through here?
Mm-hmm.
Okay, so yeah, where she's rubbing on it is that base of the occiput is where she's rubbing. That's that base of the skull there. So yeah, you're feeling all of that pulling in through there. And then, like you're saying, feeling it wrap around into those sinuses and maxillary and going in by the cheeks, going down. Okay, well, definitely came to the right place. Let's make sure and get as much relief as we can. What we're going to accomplish today is we want to take as much pressure off the nerves as we possibly can. Okay? When you take pressure off the nerves, it allows the body to function and heal as it should. Alright, so I'm going to have you first lay face down for me. Alright, so how I like to start every adjustment, we're going to scan the entire body. We're going to go from that cervical spine, going all the way down to her feet, and then we're going to look for that symmetry from the right side compared to the left side. So I'm going to start off, I'm going to palpate, just meaning I'm going to push into the spine. Let me know if you have any tenderness or any pain when I push in, okay? Yeah, so we're in the cervical spine first. Going into the thoracic spine. Any pain with any of that? Good. Going down that thoracic spine. Going into the lumbar. Any issues with that?
No.
Good. from the lumbar. Now we're getting over that right SI joint. Any pain with that?
No.
Good. Any pain directly over the sacrum?
No.
Good. Any pain over that left SI joint?
No.
Good. So we're going to come down to her feet. We want to check the leg length down on her. So we're going to straighten the legs out, bring them together. So she is pulling short on that right side. It's not much, but it is something to note. When we scan up the patient's body, hips are looking level, and actually back, everything is looking pretty level. So that is a good thing. And granted, her chief complaint was just the headaches, the migraines, and it's not like you had multiple other chief complaints or even any other problematic areas. So very common to see that that the symmetry is looking very good. So what I want to do first is I want to use the hypervolt. I want to relax all the portable massage device before we go ahead and get that adjustment started. Sound good?
Yes.
So now we're going to go ahead and start with the adjustment. As you guys like to know, I always like to start my adjustment in that cervical thoracic junction up top here. So we're going to start with the T3 here on the left. There we go. And we're going to drop down to a T1 on the right. There we go. Feel how we took the pressure off those nerves?
Oh,
right?
yeah.
Good.
Great.
Okay. I want you to take a deep breath in and exhale out. Good. One more time, deep breath in and out. Okay. So, thoracic spine didn't want to move the best, but I always do a standing intercostal and then I do a anterior supine also. So, we'll make sure and get all of that moved towards the end. So we're going to come back here, check that leg length out. As you guys can tell, it's looking a lot better. So this was pulling short in the beginning. Now it's almost balancing out completely. So what I'm going to do, we're going to check your sacrum. I want to see if there's any issues going on down here. So I'm going to stabilize on your sacrum. I want you to raise one leg at a time, but I want you to raise your leg like that for me, okay? So relax the leg first. So we're going to start with the right side. Raise this leg up as high as you can. Any pain, tenderness, tightness with that?
No.
Alright, relax that side. Raise this side for me. How does the left side feel compared to the right?
The same.
The same? Good. They both look like they went up kind of evenly. The left one may have looked like it gone up further, but
Yeah.
if you're not feeling any pain when doing that, okay, then yeah, definitely good. Okay, we're gonna just palpate in through the lumbar spine here. Any pain or tenderness down here?
A little tender.
A little tender?
Yeah.
Okay. Alright, what I'm going to have you do, I want you to lay on your side and face me. I'm going to bend the top leg. Keep that bottom leg straight. Good. Just like that. There we go. I'm going to have you flip to the other side for me. Lay flat on your back, please. Okay. Now we're going to go ahead, we're going to do a leg pull. With this, you'll feel some release in the ankles to the knees, going up to the hips as well. There we go. Feel how that went up?
Yeah. Oh.
Alright, so now I'm going to have you stand up. Alright, so we're going to do a standing intercostal adjustment. So I'm going to have you bring your arms out to the side. I want you to put your hands up and over mine. Yep, just like that. So I'm going to lean you back onto me. I got you. Squeeze your elbows together. Good. So you are definitely really tight around that upper back. Take a seat right here, facing this way. I can see why you've been getting those migraines, how you have.
Mm-hmm. I've had blood work done to see if it was hormonal.
Mm-hmm.
But
How'd that come back? The
normal.
test? Came back normal?
Yeah.
Okay. Any dietary type of things that throw it off? Caffeine, chocolate, alcohol?
I drink a lot of caffeine.
Okay. Always, even when it comes to that, kind of keep a record with the amount of caffeine that you drink.
Okay.
Maybe it could be one of the correlations between it, but just to keep in mind for yourself. Okay. So I'm going to have you give yourself a big hug. And with this, so what I'm going to have you do is take a deep breath in, then I'm going to bring you down on the table. As I'm bringing you down, I want you to exhale all the way out. Exhale out. There we go. That's why we do that. Yeah, finally got you after that one. Alright, I want you to stay laying flat on your back, knees bent off just like that. Perfect. So now we're going to do the Y-strap. Now this is where it's a manual decompression. You're going to feel this from up in that cervical spine, go all the way down to that lumbar spine. So now have you ever had a technique like this done? No? Okay. So I'm going to put this over your head. If you can lift your head up, if you can pull your hair through for me. Thank you. Alrighty. And this is where people get, or patients get a ton of relief from. So right through here.
Oh, oh my goodness. Wow.
If you feel that, stay relaxed for me. You feel how that just pulls apart? How would you describe that to somebody who's never had that Y-strap adjustment done?
Like instant, just pressure, like pressure's gone. Wow.
It's pretty powerful, isn't it?
And it's relaxing.
Yeah, it's like a lot of people, so I get people, I get patients who right in the beginning they're like, oh my gosh, that was amazing. Others that they have to lay there and like relax for a few minutes, just let them.
Knocks the breath out of you
sometimes.
sometimes.
Knocks the breath out of you because it is pretty intense. But then after, laying back, being relaxed, then you tend to kind of gather yourself up and you're like, wow, and you go to stand up. So I'm going to have you come on up. Now in the beginning, remember we just went through kind of ranges of motion. How's everything feeling?
Oh, it feels good. Feels better.
Feels less pressure? Okay. Because I know, granted, it's not like you came in with the migraine this time, but you've always had that pressure.
I was a little tight over here, and that's completely gone. But I stay tight. So it's not nothing.
Well,
but I'm not tight right now.
In the beginning, so I know a lot of the viewers know when I do the thoracic adjustments, I do the first one, the prone, then I do that standing, and then I do the anterior, the supine. The first two, she did not want to move, and I'm not going to. Granted, I could have said, all right, one more time and really use some force, but I don't like using a ton of force with the adjustment. I would rather something to move freely on its own. So, as you can tell, those two did not work as well for you, but that third one, you felt that open and release.
Awesome.
Yeah. So then after with that Y-strap, that really just pulls apart, that takes pressure off all those nerves that are exiting the spine. So
I feel like my head's moving better.
Good.
Thank you.
Keep in touch. Either send a text via the business cell that we have, or email. My wife and I always have that on us. So just let us know, when the next time you have a migraine. Hopefully not for a while.
Yeah.
If hopefully for good gone. But granted, in a month or 2 months, it could come back. Like I always tell patients, you know your body better than anybody. So when you feel, just say those migraines are coming back, let me know. We'll get you back in here. But for today, make sure and just drink, increase your H2O.
Okay.
Just kind of like massage, what you're used to. So just drink a little bit more water today and relax. Just because there's a ton of movement with that. So I don't want you to go directly to the gym, working out. Just take it easy for a day.
Okay.
Sound good?
Great.
Perfect.
Thank you so much.
You're welcome.
Thank you.
So if anyone is looking to schedule an adjustment, just go right to the website, drjosephcipriano.com. Love to get you in here. Have a good one, guys.